Saludos a todos. I would like to thank the ACP Puerto Rico chapter for allowing us to present at this year's virtual abstract competition. A special thank you to Doctora Vigo, who has been pushing interns and residents like myself to strive for excellence. I would like to recognize my colleagues, Dr. Cedeño, Dr. Haidar, and Dr. Munoz for assisting me in this presentation. We would like to give a special thank you and prayer for Dr. Jorge Perdomo Medrano, who recently passed away earlier this year, an amazing physician, human being, person who, with his mentorship and guidance, has affected many physicians on this island, and we would just like to give a special thank you for all that he's done. We would also like to thank all the frontline healthcare workers, janitors, attendings, respiratory therapists, everybody who works in a hospital that allows us to train and continue to learn. And an unexpected migration or a dormant behaved neoplasm. American Cancer Society recent estimates for thyroid cancer in the United States for 2020 show that there's almost 53,000 new cases of thyroid cancer a year, around 12,000 in men and 40,000 in women, and around 2,180 deaths from thyroid cancer, split evenly between men and women. Metastatic thyroid nodules have been considered a rare occurrence, representing approximately 1 to 2.4% of all thyroid malignancies. The most frequent origins of primary tumors migrating to the thyroid comprise of kidney, breast, lungs, esophagus, stomach, depending on epidemiological variances in major cancer types and different populations. So we present a case of a 7-year-old female who presented to her yearly well woman visit exam. Physical examination was remarkable for diffuse enlargement of the right lobe. A thyroid ultrasound was performed demonstrating a multinodular goiter with the largest nodule located on the right thyroid. Patient's TSH, T4, and serum thyroglobulin were normal. An ultrasound-guided fine needle aspirate biopsy was done, observing a 3.8 centimeter hypoechoic nodule with irregular borders on the right middle lobe, and a biopsy demonstrating non-diagnostic cytology. Patient was referred to an ENT surgeon who, in consideration of the size of the nodule and high suspicion for malignancy, performed a total thyroidectomy. On past medical history, she had no exposure to radiation and denied any family history of cancer. Interestingly, though, the patient had a diagnosis of left renal cell carcinoma 15 years prior, which after radical nephrectomy was classified as nuclear grade 2. Since that time, the patient was watched very closely by her urologist with serial radiological studies with no evidence of disease until she presented with this thyroid nodule. Final pathological report revealed a 2.7 times 1.7 centimeter mass in the right lobe consistent with metastatic renal cell carcinoma, clear cell type, identical to the previous tumor 15 years ago. Immunohistochemistry also confirmed its primary origin. After discussion with the tumor board, 1 dose of ablative radioactive iodine and subsequent surveillance of metastatic renal cell carcinoma was initiated. And our patient, unfortunately, despite frequent observations by the oncologist, developed 2 pancreatic lesions secondary to renal cell carcinoma 2 years later, confirmed by core needle biopsy. So here we have a picture of the renal cell carcinoma biopsy. As you can see, the clear cell type. Now, renal cell carcinoma tends to migrate in an unpredictable manner and can show late recurrence as a notable dormant biological behavior, appearing even 10 years after curative primary surgery. It has been reported that 4.3 to 9.6% of patients who remain free of disease 5 to 10 years after curative primary surgery eventually develop recurrence. In one large case series, thyroid metastases was longest for those with renal cell carcinoma, on an average about 113 months. Metastasis of renal cell carcinoma usually occurs in the lungs, bones, lymph nodes, brain, liver, skin, with other sites such as thyroid described much less frequently. Albeit secondary involvement of the thyroid gland by renal cell carcinoma is rare, less than 0.1%, renal cell carcinoma is one of the most common neoplasms that metastasize to the thyroid gland. This case illustrates the unusual slow-growing nature of renal cell metastasis as previously postulated. In this patient, 15 years ago and 17 years after radical nephrectomy, considering that fact, implementation of lifelong surveillance might be necessary. Concerning treatment, optimistic results have been published with metastastectomy and systemic targeted therapy. Thank you very much, and we hope you enjoyed our presentation.